Good morning, all.
Good morning. So we are back again with a live stream session. So today we'll be dealing with writing subtest, right?
Yes.
So I think we have to wait a couple of minutes more so that others can also join, right?
Yes, sir. So before that, let's introduce ourselves, right?
Yeah. So I'm Alvin and I'm an OIT trainer here at AJINORAH.
Okay, I'm Varna. I'm OIT trainer at AJINORAH, Kochi. So,
Ma'am, hello. Good morning.
Good morning, all. So we are waiting for our students. So here, as you know that we are here something really regarding writing.
Yes, a kind of different kind of letter and that we are not much familiar with.
Yes, exactly.
So I think all are joining, right? Vibin sir, good morning.
Good morning. Hi, Fessy ma'am. Okay. So I think that's let's reveal the glad news with the students.
Yes, something interesting.
Yes. So we have received the last exam result.
That is of September 2nd, right?
Yes.
OET.
So again, AJINORAH have 200 plus success story and 200 plus success result. So it was a good moment to celebrate.
Yeah. And we'd like to congratulate every winners and the trainers, everyone who just.
So wish you all the best for your future, for our dear students who cracked the OET, and I really taking this time to congratulate our trainer for training them effectively.
Their effort.
Yes. So we are waiting for the students to join on. So later we'll start within very few minutes. Okay. So I think that they are joining. Shall we start with the briefing and all those?
Yes. So before that, just to make you notice, Apsha ma'am couldn't make up today because of some emergency. So that is why very familiar Varna ma'am is with me.
Okay.
Once again, welcome ma'am.
Yeah. Thank you so much, sir.
Okay, so I think we can move on to the topic. So I think I hope you can see the topic on the screen. So it is drafting an impactful letter to an organization to seek special arrangements. So the title or the topic seems different, right?
Exactly.
So I think we have got some peculiarity with that. So can you please brock this?
Yeah, I will make it more evident right now. See, for students, actually, they will learn how to construct their letter. They are actually easily will take on the format of the letter. But even though in the exam batch, they are really confused how to organize the letter, which data they have to pick on, or how to construct the letter, how to organize it, or how to arrange the data. So it is really hard to know how to make it so simple and so evident or so clear.
Yes. So we know that the target score is, a minimum of target score is C+, but it is really difficult to get a band score of C+, because writing is very, very sensitive, and even a small mistake can cause big effects, right?
Yes.
Especially like gender changes, then lack of organization, everything can matter.
And kind of unnecessary punctuations and all those. So here we are going to discuss, or we are going to tell you how to organize the letter in a very simplified way. So
yes, because in a daily basis you are writing letters of same pattern to seek medical care, to request some kind of special arrangements, everything. But today what we are going to deal with is that nursing is a dynamic profession, and we have got many roles and responsibilities. So actually the purpose of the letter differs. So how to construct a particular letter in which the purpose is different. Yes.
So say according to the reader and according to the purpose of letter, the data we have to take on from the letter will vary, and the way how we have to put on the data, like the organization. The first paragraph can be the present, or sometimes the first paragraph can be the past. See, it's all up to the purpose and the current health status of our patient.
Yes. So what we have to make you concern is like don't be you have to be flexible. That is the important point, because don't by heart that if a social worker is the reader, then definitely you have to start with social history. If it is a nurse, then present history. Don't by heart like that. You have to be flexible to construct a proper letter, right?
See, actually, it is really easy. As this is a tip I got from Alvin sir. He always told that, see, make your letter as a kind of storytelling. So
Yes.
when I
Yes, because the kind, especially nurses. So if the nurses, when they are working in the hospital, if they are told to refer their patient to a particular ward or very another person, definitely they can simply do that even without looking at the patient case note.
Yes.
The same thing is what we need, and the only difference is that we need it in English, and we have got a very little criteria for
Yes.
that. So by telling the criterias, we are not going deeper into the criterias, but as an introduction, can you tell me what are the criterias for writing?
Yeah, sure. There is actually 6 criteria for writing. The first one is purpose, second one is content, third one is conciseness and clarity, fourth one is organization and layout, fifth one is genre and style, and the last one is language.
Yes, so those are the 6 criterias, and one thing that we can actually use that once you have met all these 6 criterias in your letter, or if you could make sure that one after completing the letter, if you could make sure that you have met all these 6 criteria, then definitely your score will be above 350.
Exactly.
So that is the importance of criteria. We do not have much regulations in writing, only the 6 criteria and certain advices regarding the connectors and all. So that is a very minimized thing, and all other which is really based on our English efficiency, right?
Yes, see, I just want to mention you something. There is not any kind of very perfect letter. See, we are scoring, or we are putting, or we are assessing your letter through this criteria. If you have meted this criteria, surely you will get your required score. So in your perspective or in your creativity, you can construct the letter as simple as it is.
Yes, so that is one of our criteria also. Conciseness and clarity is also one of our criteria. So the thing is that try to make your letter as concise as you can, even though we have a word count of 180 to 200 words, but it is often appreciated if you could concise your letter, because the point of view differs, because it is really easy. So if your letter is very concise, it is easy for the evaluator to read and give you marks. So that is also a kind of different point of view in case of letters.
It should be short, at the same time it should be so clear to the reader. You should not make any kind of confusion. So it is really important to eliminate or omit the irrelevant data.
Yes, and also the speciality with OET writing or OET letters is that a candidate with a very minimum or a very average English proficiency can also simply get a B grade, because we are not expecting a greater proficiency in English. We are just expecting very average, so that you can construct very simple sentences, you can use connectors and make the meanings clear.
Yes. See, the pattern, you know that you are writing letters. See, in the past history, sometimes it is given as hypertension or diabetes mellitus, and in another letter it will be given as diarrhea, vomiting. Whatever it is, you are writing the past history. There is a format of writing.
Yes.
So you are learning the format, and you just want to copy or just want to replace the certain words or the certain things instead of the particular place. So you don't want to bother about is there any problem with the grammar. So it is actually simple way. By writing the letters and by learning the format, you can simply construct the letter.
Yeah, the thing is that they are just simply referring their patient, so there's nothing much to worry about to refer their own patient regarding whom they are very clear, their history is clear, everything is clear. So I think that is how they can refer their patient and write a letter. So before that, one more thing, what about the purpose? So I believe that choosing the right purpose of the letter is very important criteria to get a B grade. So how can you choose the correct purpose, whether the purpose differs, what are the different kind of purposes? So I think the purpose also differs, especially in today's topic is also like that.
Yes.
So there's a different kind of purpose. So how will you confront with such kind of letters?
There are different purpose, and surely in the writing track it will be so evident. It will be, or in the discharge plan they will give us further assessment and management, ongoing care, rehabilitation care, or further support and guidance. Or if it is given us for encourage a patient, some kind of things will be given. So these are the main purpose. See, purpose to figure out the purpose, it is not a big deal sometimes, but sometimes it will be kind of a tricky one. And if you are finding, or if you are writing the purpose and the wrong way, your entire letter will be in a question mark, because according to the purpose we are selecting the data and we are organizing the letter.
Then most of the other criteria will be also in problem, right?
Yes, exactly.
So before once again we'll look to the topic. We are not going deeper into the criteria as it is not our topic for today.
Yes.
So the topic is drafting an impactful letter to an organization to seek special arrangements. So impactful letter, what do you mean by an impactful letter?
It should give the perfect picture, or it should give the what? It should make sure that okay, what we are expecting, or what we are expecting from the reader to do further. That should not have any kind of confusion regarding your writing. So kind of we are expecting that kind of the perfect like effectiveness.
Yes. So as we mentioned earlier, the kind of same pattern of this is a letter in which the pattern is different. Usually you refer patients to seek a better medical care, or to request any particular care, continuing care and management, everything which is related to medical care, right? So in today's letter, what we are going to do is to deal with a letter in which the purpose is different. It is not a medical care, or we are not referring the patient for a medical treatment. So it is, we are like we are requesting to do some special arrangements and all with any organization. It might be an organization. So it is always not compulsory that we should always refer the patient to any medical institution like hospital, community health center. This is not always necessary, right? As I told you, we have got very dynamic roles as a nurse. So I think we can move to the letter. So the thing is that we'll be showing a case note, and we'll be discussing the case note, and afterwards we'll be dealing with the answers or the letter, right?
Yeah, sure.
So to begin with, we are discussing an OET official letter. I hope everyone is clear with OET official letters. We have 5 official letters, and if anyone who does not know how to take or have to access OET official letters, they can directly Google into OET official website. They can at the top corner there is a menu, and from learning option you can get sub-test.
It is, I think easily you can access that. There will not be any confusion.
And it is always appreciated if you could write letters as it is given in the official letters. It is also good to score good marks.
Actually, official letters are more simple. Like the students are trying so hard to make it as kind of with the connectives and kind of things. See, in the official letter, you can simply say that it is kind of, they have given the relevant data in a kind of organization. So now here we are going to discuss how to make
when we are discussing the letters, if you have got any doubts, you can definitely comment in the comment box, right? So we'll be moving to the case note.
Yes. So shall I read this then?
Yes. So the thing before moving to the case note, the first thing that definitely we have to read is the writing task. So definitely we'll be going to the writing task initially. Yeah, please.
So here it is given as, using the information given in the case note, write a letter to Mr. Quillen,
Mrs. Quillen,
Mrs. Quillen, a university practice nurse. In your letter, briefly outline Jake Peterson's history and your consent, and the addressing party is given. I think that it is not.
Yeah, it is not necessary. So the thing is that to whom you are addressing the letter? You are addressing the letter to a university practice nurses. That is what we just discussed earlier. Dynamic roles of nurse. So kind of different. She is not a community health nurse. She is not a charge nurse. And she is a university practice nurse. So definitely so the first thing that we are reading is the writing task. So from the writing task itself, we can understand that the thing is different, or the thing that we are going to confront is a different kind of letter, because university practitioners doesn't need anything which is
kind of
medical related something. So it might be some special arrangements, anything. Yes.
From the writing that it is clear that like more than a medical history, she or the student, or not kind of a student. Yes, the patient is a student. Okay.
Yeah.
The patient required something as a help in the kind of academical things. So we have to mention that kind of a priority.
Yes. So when we are framing the letters, there are many things that has to be cleared about. So we'll discuss it one by one, right?
Yeah, sure.
So we'll move to the beginning of the case note.
Okay. Yes. So here it is given, today's date is 30 August 2019.
Yeah.
So it is really important to know the discharge date or today's date. Okay. And you are a nurse at a boarding school. Jake Peterson is a male student at your school and has come to your complaining of hair loss associated depression.
Yes. So the thing is that one point I would like to make clear is that after reading the writing task, before moving into the letter, the very first thing that you have to make clear yourself is the background or the kind of setting. You know, it is really important to know whom you are, where you are working. Are you an emergency nurse? Are you a community nurse? Same like you are a nurse
Nurse
was working
at
at a
boarding school.
boarding school, because the kind of introductions, the kind of construction, everything differs
Yes.
actually according to the setting of the nurse.
I just want to add on something. So usually we will write the letter as a nurse in a ward or kind of hospital, and here it is something really different. And we are a nurse who is writing the letter, and we are working in boarding school. And the reader, we are writing to a nurse itself, but she is someone who is practicing in the university. So surely it is evident that it is something really academic.
Yes, it is really academic, and from school to university means, I think the student is moving from school to a university,
Yes.
because there's in all other cases there's nothing relevant to write from school to a university.
Yes.
So I think Jake Peterson, so he's our patient. So I think this is how you have to make. We are discussing it, right? So this is how you have to make, or you have to create a story of your letter. Okay. So once we have seen that Jake Peterson is our patient, and he's now in a boarding school, and we are the nurse working in that boarding school. So now I think after his studies from the school, he's being shifted to the university. So I think Jake has got some problems. So we are discussing it before looking to the case note, right?
Yes.
Yeah, Jake may got some problems that the university practitioners has to be aware about.
Yes.
So we'll see what are all the problems.
So the name is given, as we mentioned, Jake Peterson. The date of birth is 17 March 2001, and he is 18 years old. Okay, and address is given, and we will move to the social background. Student at boarding school for past 8 years. Parents work and live abroad. Father male pattern baldness onset in 50s.
Yeah.
And mother depression onset in 40s. Non-smoker, 20 unit alcohol per week. Karate black belt. Champion swimmer. Okay. Then present complaints, as in the first briefing they have given that complaining of hair loss and associated depression.
Yes. So the presenting complaint of Jake Peterson is alopecia. We know that it is hair loss from 13 years old. Now he is 18 years on. He was suffering from hair loss for the past 5 years.
5 years.
So 13 to 18. So he has got intermittent cycles of hair loss and hair regrowth. And etiology is not confirmed. It may have got various possibilities. And also he is also suspected of depression earlier. So make sure that this is not today's case. This is the presenting complaint. Okay, years back.
Yeah. So, and the couple of list is given, like kind of treatment summary to March 2014, May 2014, then
a period of 2014 to 2018.
Kind of 4 years of yes.
So to begin with, in March 2014, Jake presented to our school clinic with hair loss in patches, and definitely in a very younger age, if he has got hair loss, definitely he will be anxious.
Yes.
So he has got anxiety. And is not sure about the onset and all, school bullying incident, which is not much relevant. So patient said not a major thing, but as a part of management, we referred the nurse referred him to the trichology specialist. So what was the finding of the trichologist?
But actually here something, the trichologist, no etiology established.
Yeah, he's not
here
able to
also we are not able to figure out what is the reason for it, and possibly it can be by stress, but it is not sure, but
possibly exacerbated by stress. Yes.
And prescribed some kind of steroid creams, and the name of cream is given over here, and it is given that
so something weird happened after taking steroid cream, because he has got personality changes,
aggression plus sleep loss.
So definitely he has to discontinue the medication. It is
So as a part of taking this medication, maybe it is a kind of complication of that medication,
or maybe a side effect,
kind of a side effect, and he have discontinued the medication. And moving to the next, and regarding to the 2018, so here it is kind of 4 years of
for a period of 4 years, 2014 to 2018. No further hair loss.
Intermittent.
Also, he has got intermittent hair regrowth.
Something has got.
Yes.
And 2018 December. Return to anxiety and pronounced hair loss again. So he got the same condition, general health check, and decreased 6 kg over last 2 months. Something has to be noted.
Yes.
Then recommended to see a doctor
regarding hair loss, anxiety and weight loss, but Jake was reluctant and asked about natural remedies like homeopathy. But Jake is still keen to try. The thing is that he inquired about he started homeopathic treatment, but by February 2019
results.
It has got no results, and due to the cost implications of homeopathic treatment, again he stopped that. So again the thing is that
increased distress and low mood. So
he's depressed.
He is having some kind of not kind of mood disorder. Actually, he's not feeling well with the
He feel depressed.
Yes, depressed. The problem forming and kind of
maintaining pure relationships.
Obviously.
Because,
Affect sport because it is given that he was a champion.
Yes.
Okay, or a kind of in swimming, but yeah, it was also affecting his kind of sports
participation.
activity.
Yeah. Then by March 2019, he was referred to school counselor, but he didn't attend that session also.
And by May
2019,
here it is given that checkup done and increased alcohol consumption
minimum 28 units per. So earlier it was 20. We have seen that
20 or 24.
20 units per week,
and it is 28.
Increased to 28 units per week.
So in June to July 2019, exam time, extremely anxiety necessary to arrange separate exam room. Okay, due to and it is given that increased hair loss.
Yes. So during the it was really necessary to arrange separate exam room.
Then 30 August 2019, student concerned about transition to university shortly, because we know that we are writing the letter to the
university practitioners. So definitely a kind of transition from school to university. In which anxiousness really comes into play.
Yes. Independent living and letter to university medical practice.
So the purpose is to
monitor, and next one is organize special exam arrangement.
So this is the purpose of the letter, and from the purpose itself it is very clear that it is not something which is medically related, right?
Yes.
So this is the kind of case note that we have got again regarding Jake Peterson. So Jake Peterson is a student at a school, boarding school, and we are a school health nurse.
Yes.
And he has got hair loss. In addition with he has got depression, anxiety and all. It is not like a kind of diagnosis. He feels depressed. That is, I think that is the most good word to explain that.
He feels to be, and it is given that in the first data, first initial stage, it was given in question mark, suspected, not confirmed. And coming to the last also, it is low mood and kind of evident he is having the same. But yeah, so we can say that he is having kind of depression, and it is so evident.
Yes, but the thing is that regarding the queries or the suspected and all, in this particular letter, the medical relevance of the letter is not that much important, because we are giving a general idea or general brief idea regarding Jake Peterson to the university practitioners. So the kind of medical relevance of histories and all, the name of medications, everything, it goes irrelevant.
Yes, exactly.
So we'll again move back to the case note and pick out, I think we can pick out relevant information.
Yeah,
right?
Sure.
Yes.
So obviously we have to take the today's date.
Yeah, will you please stick on the relevant information?
Yeah, sure. So first one, that it was in the previous slide about the today's date, and I have mentioned when I was reading that. Okay, so name is required.
Date of birth. He is 18 years old. So I had some kind of an extra piece of information regarding the age. So we know that we usually call patients, or the people more than 16 years old with their title, like Mr. Jake, Miss, Mrs, anything. So in this case, when we are writing the letter, we are not we are not using the title of the name. Why? Because
it is actually, as sir said, we are mentioning that 16 and 16 below we are considering kind of child or children kind of, and we will mention only the first name. But here it is 18, but even though we'll start with the name, first name, because it is clear, it is given that he is a student, and he was in the boarding school and kind of schooling. Okay,
and we work in the same place.
We work in the same place, and moreover that we are writing this letter to the university practitioner, kind of university nurse. So kind of school kind of a kid, so we can mention
and the patient has also got more than 4 or 5 visits with us, and we'll be very familiar with the patient. So it is not of that kind by calling him Mr. Peterson.
Kind of better to make it as kind of friendly rather than a formal one, because he is a student, so a friendly approach will be more good.
So that is why we are using only the first name of the patient in the letter, that is Jake.
Yes. Okay. So and all those things, and student is at the boarding school
for the past 8 years. You can just add that as a kind of brief starting to the paragraph.
Because we want to show that we know him before, and he was under our guidance or kind of stuff. Okay.
Yes.
So
parents work and leave abroad is not necessary, because he's staying in a boarding school means parents is, or he's not
obviously.
near with the parents, so you can avoid that.
Here there will be a confusion regarding this too, because
very strong family history, really strong. He has a mother has got depression, father has got male pattern balance. He has got very strong family history, so everyone will be thinking, yes, definitely I have to.
Yes, we have to write this because mother is having depression and we are suspecting he is having depression, but it is not required.
Yes, because this is not the purpose of the letter. Our purpose of the letter is not to seek any medical care, or the medical, as we told earlier, the medical relevance is very less. So please don't need to write the histories of father and mother, because the university practice nurse who's gonna arrange,
can't do anything by knowing the past, the family history of yours actually.
And also the university practice nurse who's gonna arrange special exam, or to ensure that special exam arrangements has been made, does not need to know that he has got the history of father and mother.
Yes.
But in same letter, if you were writing to a hospital or a doctor, definitely you have to mention this.
Okay. And moving to the next, non-smoker. So no need of that. He is not having that habit, so no need of mentioning it. For in OIT letter, try no need of mentioning anything as normal. Okay,
Yes.
so normal data or normal investigation, or kind of not having any kind of.
Everyone has a they always write vital signs were assessed and they are unremarkable.
Yes, it is stable. It is okay. No need of that actually. If you want to write that, okay, it should be having this some kind of relevance with the particular condition
So
of
if you're
your
trying
patient.
to make your word count, what we have to say is to forget about your word count, because they have OIT have designed the letter in such a way that definitely if you include only the relevant data, you will be able to write within 180 to 200 words.
Yes. So one more thing is that 20 units
of alcohol per
week.
Yes, I think that is quite relevant, because the amount of alcoholism was increased due to his anxiety, kind of depression and hair loss and all. So I think you can mention that.
Okay, and one more thing is that at the end of the letter it is given that he increased the use of it. If you like, kind of. Yes.
Yeah, progression, right?
Yeah, progression.
So you can mention that also. Then.
Okay.
Presenting complaints.
So alopecia. Okay. Here, but we are already mentioning that hair loss.
Yes.
Okay. More than alopecia, because we are writing a letter to the university, like a nurse in the university. So better
she's not that in contact with
medical
terms. So it is always good to mention the name hair loss.
Yes.
So, because the thing is that we are writing to provide a brief picture of Jake Peterson. So hair loss is necessary.
And etiology is not confirmed.
Query of depression is not needed,
choice.
because as we do, the thing is that the rationale is very clear. Medically, it is not relevant.
Okay.
Yeah.
Moving to all these treatment summary, we can make it as a very concise or a very precise story actually.
Yes. So there is nothing more to write in this letter. There is no much past history present. The only thing is that very small, a brief picture of Jake. Yeah.
And Alvin sir, one more thing, the student have it should be passed. One paragraph should be passed and one paragraph should be present. Is there anything like that actually?
No, there is no such kind of preset. Please don't make any such kind of preset intentions to separate your paragraphs so that one is past, one is present, so I can write the social. There's nothing like that. The thing is that you are simply referring your patient to a particular center, and only relevant things which is very close to the reader is necessary. So you can mix up doesn't mean that you can write in between and all. So the thing is that you can mix present and past, you can mix social and past, social and present. Always search which is the relevant history, give importance to that.
Yes.
So
one more thing I just want to add, we always tell to the students that both we have to manage, both we have to we want to mention the present, social, past. Okay, so in that scenario we can go with one paragraph present and one paragraph social plus past.
Yes,
because it is to make sure that the organization is neat and clear. So that's why we are giving like that. So, and if something that in the past have the very kind of very important to mention in the present, okay, fine, just go for it. So there is no any kind of we have to go for this present and we have to go for this past, because here there is no any kind of past actually. We have to go with the present.
Because simply you are referring a patient, and it is very important to meet the apparent needs of the patient. So that has to be given the importance.
Yes.
So like for example, if a patient we are referring the patient to an emergency department, he has fever and he has increased bleeding from any of the wound sites. So which has to be given the predominance? Definitely bleeding has to be given the predominance. So likewise, you have to meet the apparent needs of the patient.
Okay. So moving to here, so present with hair loss and patch, anxiety, onset is in question mark.
See, no need to mention about the onset and all in the letters.
And school bullying incident and not, okay, patient said not a major thing, okay, refer to trichology. Okay, we have to mention this about
yes, that is a kind of management that we have done. So we have referred the patient or Jake to the trichology specialist. However, you see a connector can be used, right?
Yes.
However, he is not able to establish the etiology and possibly exacerbated by stress and all is not
and
needed.
We have to mention about the steroid cream.
Yes, because the personality changes begin from there.
Yes.
So definitely the steroid cream becomes relevant. He was prescribed steroid cream.
Most of the data from May 2014 is relevant.
Yes, but do we need to mention the dates everywhere?
Not really. Not really. We can just just go with the data. Actually, this letter is so simple. You just want to pick out the most data and one by one order.
So the today's date in which we are writing the letter is the year is 2018. So we are commenting about the year 2014. So it is already being 4 years. Then there's no point in commenting the date and all, and it is very not at all relevant.
Yes. So 2018, no hair loss and intermittent. Is that so important? Yes, kind of importance are there because in between he got a relax or he got a.
And also the thing why it becomes relevant is that the condition of the presenting complaint of Jake has exacerbated after 2018.
Yes.
So we have to, when we are writing about, when we are commenting about a certain thing, there must be something to balance it.
Yes.
So in order to that, we are mentioning during the period of time 2014 to 2018, he had no further hair loss and has had intermittent hair regrowth.
Yes. Okay. Because at the end of the letter, which means presently he is having so much of psychological not kind of psychological rest, but he is having low mood and kind of he is suffering psychologically.
Yeah, definitely he will be really anxious because of such an younger age. He has got alopecia, hair loss and everything. So definitely he might be anxious.
Yes. So moving to the 2018 December, okay, again the kind of hair loss it is,
yes, pronounced hair loss.
We have to mention about he got the hair loss again. He's returned. Yes.
Yeah. Then he has lost his weight about 6 kilograms over the last 2 months.
Yes, and it is actually showing what are the kind of the deepness of his condition.
Yes.
And about how he
was recommended to see the doctor regarding hair loss, anxiety and weight. No need to mention regarding hair loss, anxiety and weight because he does not have any other problem.
Yes.
So definitely if you are going to recommend a doctor, definitely the condition will be the same. So no need to mention that.
And yes. So about this, asked about this natural
remedies. We inquired about natural remedies like homeopathy.
Yes.
But the thing is that he again discontinued that because it was ineffective and because of its cost implications of the homeopathic treatment, he discontinued that.
Yes, so this also we have to mention something. We have he has started, but it was into the complication, and later on he increased the distress and low mood.
That
so
is also
it is
very important.
Kind of relevant now.
Yes. Then problems forming or
and
maintaining peer relationships.
Okay, affecting fine.
That is, you can add according to your construction or the word count.
If you want, you can simply add on like it is affected badly.
Yeah, because this is the thing that he still has. So definitely you can write he has problems forming and maintaining peer relationships, but it is kind of semi-relevant information.
Yes. Okay. So moving on to the next slide. Okay. So referred to school counselor did not attend. Then increased consumption of alcohol.
That is from 20 to 28.
Yes. So. And something really important, extreme anxiety necessary to arrange separate exam room.
Yes.
Okay, exam time, during the exam time, and this is the purpose of the letter.
So the thing is that so the thing is that during the exam time he is experiencing very increased anxiety and all. So why we are writing the letter means when Jake has gotten admission in the university and when he has gone to study in the university, they are not pretty sure about his condition. So that is the reason why we are giving a brief picture about Jake. And when we want him that we have to we want the university practitioners to monitor Jake and to ensure that special exam arrangements are made. So please don't write that kindly organize special exam arrangements, because it is not that kind of proper way, because there are many people who can organize special exam arrangements. So what is the duty of the university practitioners is that to ensure special exam arrangements are made. Definitely
because she have to ensure it whether it is is happening or not. So
yes. So I think that is about the case note and its selection of relevant and irrelevant information. So we'll just wait for a couple of seconds so that if you have got any doubts regarding the case notes, you can ask us.
And in the comment box.
Yes.
Okay. See, not only regarding to this letter or this case note, if you have any common doubts regarding writing,
definitely you can ask.
Yes, definitely you can ask in the comment box. Yes.
So I think we can move to the letter. So it would be good if you could take the official letters now within your hand, because they have got the answer also for in the same PDF.
Yes.
So we'll be moving to the so we have already seen the writing task.
We'll go with the
sample letter. Yes. Okay. So this is a kind of pattern or the format of address that they have used in the official letter. But don't worry, you might be studying different kind of formats. Everything is right. This is a kind of format in which official letter has been written. No problem, because we usually used to write date in front.
If you want, you can write the date in the top of on the top of your letter, or you can start with the addressing part, and next line you have to mention about the date.
Yes, but make sure that about the lines that you leave in between, because if you have told to leave one line, just leave one, don't leave two, because organization layout is also an important criteria. So each and everything that you begin in a paper should begin from the very left side of the paper, right?
Yes. So and like in the orientation, I'm telling the students that if we are drawing a line, it should be perfect line.
Yes.
Okay. Usually we have the tendency that we'll start the paragraph with the center, or
we used to do that from the school, maybe from the colleges.
It is not your fault, actually. We learned accordingly. But in OET we have to go with the perfect lining from very close to the margin. Okay.
So this is a sample trend. I hope the format is clear. The references Jake Peterson. See, they're not using the title.
Yes.
Jake Peterson. Then date of birth.
Because we are considering this as a kid or child.
Student.
Yes, student. So we don't want to mention, as we said, that any kind of Mr. Because it is always go for kind of very friendly kind of conversation, and because the student are well known for us.
Yes. Then date of birth, again regarding the format of dates. Can you please tell me about the different format of dates?
Different format of date. Actually, we have 4 format. Okay, the first one is this. As you can see in the presentation, you can see it's a kind of a dot format. 17.
Can you please write a very different format? One format.
Okay, I will go with the bar format of the same. It's a kind of numerical one. Okay, I'm not. My handwriting is not good. It's like kind of okay. So 17.
This is another format that you can utilize when you're writing the dates.
17. Okay, and one more format, like the third format. Actually, I usually prefer to go with that because we learn the format first. Okay.
Any format.
Any format. Okay. There is no any kind of you want to follow this format. It's not that you can go accordingly.
So this is also another different kind of format by which you can write the dates.
One more is there. Okay.
Yeah. Again, many formats. So please don't be confused with seeing this. The thing is that please follow the format that you have always been thorough with.
Just follow it. This 4 are actually I think that it is overlapping with the presentation. You can see in the live actually.
Yes.
But it is one nothing. I just put a comma just after June. That's it. Okay. So hopefully I think that it is clear to them. Yeah.
Yes. Any doubts?
If they given both, okay, I was about to ask that.
Yes.
If they have given the date of birth and age,
it is always good if you could mention the date of birth of the patient, because the age you can mention in the body paragraph.
And one more reason is that date of birth is most accurate data rather than age. Okay, so better to go with
date of birth. If there is both date of birth and age, date of birth is most appreciated.
Yes, and someone asked to mention about the purpose again, but moving to the letter, we'll explain that.
Explain the purpose, by the way. So
we no need to mention age, or I think that we have given explanation for that.
Again one more.
The salutation, Mr., Mrs. or Miss. Okay, well, we can necessary in the address part. Okay, they are asking about the address part. If it is given in the address part, better to give with Mrs. And I think that it is not. Okay, so Mrs. Okay, so we can mention it is fine.
No
Mrs.
problem.
Okay, we will add on it for them.
Yes.
Okay.
So we'll move on to the first body paragraph.
Okay. So address part. So we have given an answer for that. Mrs. is fine. It is not wrong. Add on Mrs. So we
Yes.
will go with the pattern. So it is fine. So shall I read the introduction then?
Yeah, this is our introduction paragraph. So before reading the introduction paragraph, there are 4 components that has to be included when you write the introduction paragraph. So which all are the 4 components?
Yes, it is really important to note this thing. If you have the note, just keep on noting these 4 points in your notebook. The first one is full name of your patient. Second one is type of letter. Third one is purpose of letter. And the last one, current health status of your patient.
Yes.
Not the diagnosis, current health
Yes,
status.
don't think that you have to mention the diagnosis of the patient. It is the current health status of the patient.
And one more information, if you, it is not mandatory. If you want, you can mention about the discharge either in the introduction, but it is not mandatory.
Yes.
Either in the introduction or in the recommendation. So because otherwise, if you are mentioning the body paragraph, it will be so confusing. So it is not mandatory.
It is not necessary to mention in the body paragraphs. If you want to mention that in the introduction paragraph or in the recommendation.
So 4 things I repeat once again. Full name, not the first name, because we are using the full name only in the reference part as well as the introduction.
Yes.
So full name of your patient, type of letter, purpose of letter, then current health status of your patient.
Yes. So this is the introduction, introductory paragraph. So one more thing, everyone thinks that the introduction paragraph has to be 3 to 4 lines or 2 to 3 lines. So you can see it is very short.
Very short and just 2 lines.
Yeah, so it is always not necessary to make or to formalize that thing into 2 or 3 sentences. It is very precise. Write the introduction paragraph as precise as you can. Very sticking on to the purpose.
Yes. Okay. So shall I read this? I am writing to introduce. That is a type of letter. Okay, I'm writing to introduce Mr. Jake Peterson.
Full name of the
full
patient,
name of your patient, and 18 years old student at the school who is about to start studying at Marchbank University. Jake present with her lows and associated depression and anxiety.
Yes. So the thing, one thing that you have to be aware is regarding the comma, right?
Yes.
After the name Mr. Jake Peterson, we have put a comma because an 18-year-old student is an extra piece of information. So whenever you are mentioning an extra piece of information, definitely you have to put a comma. So I am writing to introduce Mr. Jake Peterson. So I often advise our students to avoid the template I am writing to. So if we avoid I am writing to, how can we formalize the letter?
Are you asking about the thank you for accepting, or
maybe thank you for accepting, or like in this case thank you for accepting or seeing is not that much appropriate, because even if he is not even if he has gone to study in the university, it is like thank you for accepting and seeing is not
then
appropriate.
Shall we start with the
name of the patient? It is always good if you could it is always good if you could begin the letter with the name of the patient. So Mr. Jake Peterson
okay, an 18-year-old student. So except this, I'm writing to introduce the rest of the things.
Yes.
Am I right?
Yes.
Yes. Okay. So, so can you just give some introduction for the, not regarding to this letter, because always the students are writing, I'm writing to refer, I'm writing to introduce, I'm writing to transfer.
Whenever an evaluator takes your paper to check the letter, the thing is that if it has gone very uniform patterns, it is not that much good, because I am writing to is always if you follow that. So it is always good if you could begin the letter with the name of the patient, like Mr. Jake Peterson, an 18-year-old student requires further monitoring. If not according to this letter, I'm just briefing about the
generalizing about this.
Or Mr. Jake Peterson is being referred into your facility. Then if it is a non-case, Mr. Jake Peterson, a patient of yours, is being referred into your, or is being introduced, anything. So it is always try to begin the name of the letter with the name of the patient.
Okay, sir, I'm sorry for the interruption. There is one more question from Umma. Okay, there no need comma after dear Mr. Kullan? Okay, see Kullan, it is actually here there is no comma. Actually, I just want to tell the clues over here.
I'm really sure that you are very thorough with that.
Yes. Dear Mrs. Kullan, it is fine. But if you're putting comma here, keep in mind. Okay, if you're putting comma after salutation, you should put comma after yours sincerely or faithfully.
Yeah, she has made it loud and clear. Once more, please.
Yes. After salutation, if you're putting comma, which means dear Mrs. Kullan or dear doctor, dear nurse, whatever it is. After salutation, if you're putting comma, you should put comma after, which means at the end of letter. Yours sincerely or yours faithfully, there should be a comma. Or the second thing, in this letter, we are not putting comma here. So at the end of the letter, there should not be the comma.
Yes.
I think it is clear
Yes.
to
And one more question from Ritu. Can we use different format for date in same letter?
Yes, actually.
Yes, but Ritu, different format, you can definitely use different format for date, but not in same letter. So, like, I think it is good if you could go on with same pattern in that.
I think they have seen this and date of birth. That's why they are asking.
So,
it is not wrong, but yeah, it is always good to go with the same pattern. It is not wrong because in the official letter,
they have given like that.
But it is always good to go with same format.
Yes.
Okay, and it is necessary to write the age again. See, actually, we mentioned about the date of birth here, so that's why we are mentioning about the age.
So it is to make our sentence more improvised or beautiful. Yeah.
If you are not mentioned, it is not wrong. Because already we mentioned about the date of birth, but if you are mentioning, it will be showing that okay, he is only 18.
Yes.
So it will show that kind of relevance.
So once again, regarding the current status of the patient, this is where everyone has a doubt arises. Who's about to start studying at Marchbank University. Jake presents with hair loss and associated depression and anxiety. See, the current status of the patient is very clear. He has got hair loss, then he has got associated depression and anxiety. So don't write. It is always good to write hair loss and associated depression and anxiety because it was associated. Usually, students used to write hair loss associated with the depression and anxiety. Because why we are avoiding that associated in before us, like depression and anxiety. Yeah, we can say that depression and anxiety occurred because of his hair loss. But the thing is that he also has a family history and things, and also we cannot always write it is associated with depression and anxiety. So that is why we have written Jake presents with hair loss and associated depression and anxiety. Okay, so is there any other doubts?
Yes, they are asked that we just told about the purpose and it is not actually mentioned here. Is that it is fine or not? They are asking in the comment box. You said earlier regarding the title of the letter, it is necessary to address in purpose, and they are asked about that. See, this is OET official letter, and one more thing that it is actually evident. We are just mentioned about start studying at Marchbank University. So it is so evident that okay, we are writing some kind of, and there is no any other purpose for the letter. And surely we will showcase in the recommendation paragraph regarding the purpose.
Yes.
Okay.
So that depends upon the type of the letter you are writing. So if this was an emergency letter, so definitely we have to write that exam arrangements, that purpose into the introduction paragraph. But this is not an emergency letter, so definitely you can give a brief idea like who is about to start studying at Marchbank University.
One more thing for them, I'm just telling. Okay, see, an 18-year-old student at the school who requires
you can write who requires further monitoring and special exam arrangements. You can also write like that,
and just put a full stop. Jake present with hair loss and then it is perfectly fine. There is no any confusion with the purpose. Then the recommendation you can write any kind of kindly expect you will do the needful kind of whatever it is in the recommendation.
Kindly ensure the things that you have mentioned.
Yes. So then it is clear. Actually, we are mentioned about start studying at the university. So it is we are pointed that we need something regarding the studies, so that's why we avoided it.
Yeah, so again you are asking doubts like where is the purpose, where is the current state. This is because you have been really into that basic format, so that is why we decided to bring up with the different letter.
Okay, they are fixed. Okay, we have to follow this, or we have to it is better to follow the same format, and if you want to use a different
if you're taking a class anywhere, or if you have got any trainers, then definitely you can write a different introduction and ask them to correct it. That is also really good. So the thing is that please don't make mistake by using different things, especially at the
yes.
time of examination. So you have to make sure with anything else. So
Yes.
you can write as you like, but make sure that.
I think for Deepthi and Bablu, I think so. It's a name is pronounced. If it is wrong, I'm sorry for it. For them, it is clear. They both asked the same dot. Okay.
Yes.
So
we'll
shall we go?
move to the body paragraph.
Okay.
So this is the major body paragraph. There's no much paragraph in this letter. This is the major body paragraph, and it has got 1, 2, 3, 4, 5, and 6.
Yes.
In 6 lines, we are just. The thing is that we are making that entire case note. I think it has got 3 pages and all, right?
Yes.
So into a very short 6 lines.
Okay, with all the history. So let me narrate this as a kind of a story. for you.
Yes.
Okay. So Jake. Okay, we mentioned only Jake. There is no any Mr.
Mr. Peterson.
Yes.
No need to mention that.
Okay.
And the reason we have already mentioned.
Jake first presented with hair loss when he was 13.
Yes.
Okay, we are starting the story.
Presenting
from the back.
complaint on age of onset.
Yes.
Both are there.
Yes. He was referred to trichology specialist who was unable to determine a specific etiology because it is given that in the case note. He was prescribed steroid cream, but after experiencing personality changes, aggression and sleep loss, he was taken off the medication.
Or he discontinued the medication both are right.
Also fine.
Yes.
His condition then stabilized for approximately 4 years.
That is from 14 to 2008. See, they haven't mentioned any single date in this paragraph, but also the information is very crystal clear.
Yes, I think just want to note on this coma.
Yes.
The thing is, we are teaching the students, if it is any kind of time indication, just try to put a coma.
Yes.
Because we are separating. And actually, the coma has a meaning of a pause or separation. So, like after his condition then stabilized approximately 4 years with no further hair loss
and some
regrowth. It is clear now.
Yes, and also if you want, you can also separate that sentence during this period, like he had no further hair loss and had some
it's up to you. If you want, say actually in your way of writing, okay, you can construct, you can just letter
Definitely
in your own way, it's totally fine. We are just showing very simplified format.
Yes.
Okay. Then moving to this, in the last year, coma, again the duration. Okay.
Yes.
Her hair loss has returned and over 2 months.
Again a time period.
Yes, again time period. So we are I'm sorry here. Okay, time period we are mentioning, we are just putting a comma. We are separating it. Okay, Jake's weight has reduced by 6 kg because while we are discussing, we already mentioned that okay, the reduction of weight within 2 months. It was within the 2 months.
2 months.
So evident he was suffering a lot.
Yes, he's really anxious about his thing, and especially if a student is gonna shift to the university, definitely he'll be anxious.
Yes, and he started taking homeopathic remedies, and in the bracket the medication.
The name of medications is not at all
relevant actually. If you semi-relevant, we can say that semi-relevant. Okay, but became upset when there was no improvement. He was referred to a counselor but failed to attend the appointment.
He was referred to a counselor but he didn't attend the appointment is also right. But the thing is that we have to make our letter more formal. There is a reason why he was referred to a counselor but failed to attend the appointment.
Okay, but a restricted word. But is not restricted actually.
But is not a restricted word. But the thing is that it is a kind of informal word.
Yes.
We have already discussed in certain live and all. It is a kind of informal word, and we have got a criteria that like genre and style. So the thing is that we are writing a formal letter instead of but. Definitely you can use however.
Yes, however, although. Fine.
So it is not a restricted word. You can use the word but the thing is that
that's a kind of. See, I will show the difference now. See, we are telling that he is having hypertension. Is there any problem with that sentence?
No, he's right.
It is actually sentence-wise, it is right.
Meaningfully also, yeah.
Yeah, right. But can you write in the letter he is having hypertension? It is, the sentence is okay, grammar is okay, meaning
it is like,
okay.
I feel that it is, we usually use that when we are speaking.
Okay, but instead of that, we will write he has hypertension. That's the difference. I think he is clear now.
Yes.
But it is not wrong. If you are using but, it is fine. But always go with the formal touch.
Yes.
I think, yeah, clear with that.
So, he was, so I think the body paragraph is clear.
Clear.
Then we'll move to the next paragraph. This is actually they have written in a sentence only.
Yes.
So over the recent school exam period, Jake suffered extreme anxiety and a worsening of his hair loss. His alcohol consumption has increased to 28 units per week. So that is a kind of extra piece of information over the recent school example. So see, I will just say. Hope you have seen the this sentence. Jake is anxious about the transition to university, about living independently. So this is a kind of recommendation that you have got in the letter or the kind of recommendation paragraph. So why we mentioned the previous history or the previous page was like, you know, we have to be, as I told earlier, we have to make balance.
Yes.
Right? Over the recent school exam period, Jake suffered extreme anxiety and a worsening of his hair loss. Therefore, see, therefore, I would greatly appreciate if you could monitor his condition and ensure special exam arrangements. So each and every paragraph that you write has to be equally related to each other. So like the last sentence of the particular paragraph and the first sentence of the it has to be related, then only you can read it in a single way.
Okay, so I think that it is clear.
Yes, once again regarding the recommendation,
I will read it. Okay, Jake is anxious about his condition to university and about living independently. We all mentioned about it. Okay, I would greatly appreciate it if you could monitor his condition and ensure special exam arrangement are made.
See, ensure, the word ensure. Ensure special exam arrangements are made, because we are not the person who's gonna arrange special exam things and all, organize special exam arrangements. That is why we are writing ensure special exam arrangements are made. Okay, so that is the purpose. So I think you have got the purpose of the letter finally here. So how it was really concise, the letter is, right?
It's really concise. Better to go with it would appreciate.
Yes, it would have. I is also a kind of OET has said that.
See, actually, yes, we used to tell that kind of yes, we provided medication or we administered me administered medication. Better to administer medication or medication was administered for. It is better to go with that. No need of I over here. And yours sincerely, there is no comma. That's why
we haven't put a comma.
Yeah. Okay. I'm kind of if I'm searching this letter, I'm giving kind of correction for this letter. There is kind of so much of gap, alignment, and kind of. So it is better to maintain a equal gap in between the line, kind of one line distance always.
Yes. So in a nutshell, what we would like to make you clear is to try writing differently, try to construct sentences differently, so that your trainers can also give the corrections. And a very small point of note for the trainers also, again, please don't be fixed with a basic format. Try to give corrections, and you know, we can also follow them if the students has got a very different correction. And also one more thing is that if you have got any doubts regarding not only writing any of this, you can definitely log into your Facebook, then OET official messenger. You can ask doubts, whatever your doubt is, you can definitely,
they will reply.
Yeah, you can chat with OET and they will make you clear, right?
Yes, exactly. So, I hope that we are done with the letter.
Yes, so I think it's time to clear the doubts. So once one doubt, Jisrani, Mr. Jake, in introduction para, is that correct? Because you already mentioned that it is not necessary because this letter is writing as a friendly manner. Yes, it is not necessary to mention Mr. Jake, because we are Jake is a student at our school, in which if I am a nurse, I work in that school. So, and the second point is Jake has already got more than 4 or 5 visits with me. So it is not necessary to mention as Mr. Jake alone. So Jake is very necessary.
Okay, if it is possible to use patient's name 2 times in same paragraph.
Yes, definitely.
You can use it, fine.
There are some areas in which when we come to the end of the sentence or where the name comes at the tip point. So in that cases you can use the name of the patient.
It is like in the beginning of the paragraph, try to use a name, and better than to mention his or he will not have any kind of complication then.
Yes, but as you see in the official letter, they have used more than one time in the paragraph. So
it is not wrong actually.
These are all the not the things that in which you lose your marks. You lose your marks if
regarding the criteria,
organization, your criteria, and your connectors, using of connectors. So this silly mistake won't cost you marks, but the things you have to be thorough with the criteria, and you have to be very precise with the organization and purpose of the letters. And also I would like to advise to that, please don't always generalize the purpose and write in the introduction, but like continuing care and ongoing care,
Yes.
further management and treatment. If you have got a precise purpose, it is always
Just go with that.
you copy that same to the introduction paragraph so that your reader will get a very clear idea from the beginning itself.
Anjana asked, will it be wrong if we write Mr. Peterson? Yes, it is wrong. Because we mentioned the reason, 18 years and he is a student, so we have to mention the first name.
Yes.
Okay, then I think that for Anjana it is clear. Alfie, if it is possible to use the name 2 times, yes, we mentioned.
We have already cleared that.
Ma'am, starting of letter you mentioned Mr. Okay, we sir have given that explanation, Mr. So it is not needed, just go with the name only. Okay. Can we use but? Yeah, always but is a problem. Yes, you can use, but always try to avoid that. Yes, I have given explanation for that.
Yes,
It
you
is a
have got
kind of
connectors.
kind of informal. Yes.
Old English, kind of old
English. See, the difference we always say, we gonna GOE,
Yeah,
NNA, but
NNA.
it is actually out of fashion right now. We are going to tell going itself. That's a change. Is there any more doubts? Some students are messaging. Rashmi is telling good morning, ma'am. Good morning, dear.
Okay, so I think the letter is clear with you. As I told, it would be good if you could access the letters and also the remaining 4 official letters.
Yes.
I think can we conclude now? If the letter is clear with everyone, I think it is time to conclude.
How to mention a name in paragraph which end with S?
Is there any particular protocol for that?
Not really.
I hope she's asking about the name of the patient, right? Yes. Or any apostrophe or what?
Okay, it is good afternoon. I'm sorry for that. Okay. Jarish, I didn't get that actually. Sonia asked for.
Sonia, the question is not that clear. So if you saying about any apostrophes or the name of the patients or anything?
Okay. So, shall we conclude then?
Yes, I think it's time to conclude the live. I hope it was clear.
It was really very short, I think so.
Yeah, it's around 1 hour finally. So once again, thank you for watching us, and we'll be back with
another topic and another live.
Yeah, thank you.
So thank you all. Wish you a good day then.